Welcome to today's free webinar for TDA members to help you comply with the Texas State Board of Dental Examiners emergency rule for COVID-19. I'm Diane Rhodes, TDA's Senior Policy Manager. Just to let you know, we received a tremendous response to this webinar. We got initial registrations or pending registrations from approximately 900 individuals. We're at a maximum capacity of 100, but we are recording today's webinar and hopefully we'll be able to make it available on our website in the future. So look in your email boxes for an alert about that. There are not going to be any questions from participants during today's webinar. When I reference guidance, executive orders, regulations, or resources, they are all included and linked on TDA's COVID-19 resource webpage. TDA regularly updates these resources, in particularly the Reopening Your Practice set of resources on an almost daily basis. This webinar today is not legal advice. Although the information that has been gathered and will be shared with you today is as accurate as I can possibly make sure that it is not the same as legal advice, which is the application of law to your particular circumstances. You also need to know that the health and safety measures laid out by Governor Abbott and his chief medical advisors on the strike force provide a phased plan for Texans to safely return to work in their daily activities. What this means is those phased plans could change. For example, if data started to indicate that we were no longer minimizing the spread of COVID-19, for example, an increase in the transmission of cases or in the amount of COVID-19 related hospitalizations or fatalities, the governor could easily take other action as necessary. So this information today is as accurate as it is in the moment. And this COVID-19 pandemic continues to be evolving, and we expect that there may be more recommendations in the future. It is incredibly important that dentists and their teams follow the direction of Governor Abbott and the Texas State Board of Dental Examiners to keep patients and dental team members safe. You're gonna have to bear with me here. This is not my favorite type of technology, so it may be a bit bumpy from time to time. So let's go through a very quick, brief history of how we got where we are today. On December 19th was approximately the first known outbreak of the virus that became known as COVID-19, and this was in China, and then the virus began rapidly spreading across the globe. On February 29th was the first fatality in the United States. On March 3rd, Governor Abbott participated in a multi-agency state planning meeting on the coronavirus and emergency response for Texas. And on March 5th, he held a press conference in conjunction with his medical team leaders from the Department of State Health Services, the legislature, and other agencies to give Texans an update on state testing capabilities for the coronavirus. So what have been Governor Abbott's executive orders specific to dentistry so far? On March 22nd, he issued Executive Order GA09 that required dentists to postpone all dental procedures that were not immediately medically necessary. On April 17th, he issued GA Order 15, which permitted dentists to treat patients who, if not treated in a timely manner, would be at risk for serious medical consequences or death, as determined by the patient's dentist. You'll notice that the GA09 order, which was issued on March 22nd, used the phrase immediate need of treatment. This discretion for dentists to provide emergency and urgent care treatment to their patients was made less stringent in the GA15 order because of the change of the word immediate to the word timely. And then on April 27th, Governor Abbott issued GA19, which allowed dentists the option to return fully to practice on May 1st. And this order has no expiration date. It does require that dentists comply with the emergency rules set forth by the Texas State Board of Dental Examiners during the COVID-19 disaster. It's important for everyone on this webinar to know how extensively TDA worked with Governor Abbott, his staff, and the strike force during the changing situation due to COVID-19, and TDA greatly appreciates Governor Abbott recognizing that dentists could safely reopen on May 1st. And dental practices wouldn't have been able to reopen on May 1st and deliver Texans the dental care they need without the TDA's advocacy. And this advocacy has always been couched in placing patient safety and dental team safety first and foremost. It is very important to note, and for dentists to not only know themselves, but share with their team, that neither Governor Abbott's GA-19 order nor the Texas State Board of Dental Examiners emergency COVID-19 rule require that dentists fully reopen. Dentists must use their independent professional judgment to determine if they can comply with the state board's COVID-19 emergency rules. For example, they need to determine if they have enough of the required PPE to treat patients in accordance with the dental board's emergency rule. Violations of the governor's GA-19 order may be reported to the Texas Attorney General Ken Paxton's office or the Texas State Board of Dental Examiners. Violations of the dental board's COVID-19 emergency rule may be reported to the Texas State Board of Dental Examiners. The governor's orders have the force and effect of law, and they are statewide mandates. A violation of the governor's order is punishable by fines and/or jail time not to exceed $1,000 and jail confinement not to exceed 180 days. So let's take a look at the dental board's COVID-19 emergency rule. This went into effect. It was adopted actually, I believe, April 30th and went into effect the morning of May 1st. I may have that a little bit off, and I apologize. It may have been in effect on April 30th. No matter what exact day it started, it is in effect now. It may be found at 22 Texas Administrative Code 108.716. So Governor Abbott approved the dental board's emergency rule that we're going to go through today, and dentists have to follow it. They had to follow it in order to safely reopen on May 1st, and they must continue to follow it now. And the rule dictates the minimum standards for safely practicing dentistry in Texas during the COVID-19 pandemic. As we did with the governor's office and the governor himself, TDA worked closely with the dental board and its staff on the emergency rule. And we appreciate members of the dental board also recognizing, as Governor Abbott did, that dentists could safely reopen. As an organization, TDA regularly communicated with its members since early April about preparing to safely reopen your practices. So today's webinar should be more of a review and not starting from ground zero, so to speak. So generally, what must you do to safely practice under the dental board regulations during COVID-19? Dentists and their offices are required to practice according to the minimum standards that are set in the rule. And these are based on the Centers for Disease Control and Prevention guidelines, and then the dental board's emergency rule itself. It's important to remember that CDC guidance and OSHA guidance and other guidance I may reference today is just that, guidance. They're recommendations. The regulation comes from our statutes, the governor's executive order, and from the dental board rule that we're going to discuss. You also need to remember that your patients are going to have some anxiety about returning to your office. This will be on top of many patients' normal anxiety and fears about going to the dentist. So it's important to take time out to explain your new COVID-19 office procedures to them, explain that this is to continue ensuring a safe environment for them, for your other team members, and for other patients. So specifically to the dental board's emergency rule, what do you have to do? Well, dentists have to create, implement, and train their dental health care personnel on COVID-19 office procedures. Those procedures must include a patient pre-screening protocol, in-office screening protocols for patients and dental health care personnel, transmission-based precautions, and a protocol if a DHCP suspects an exposure to COVID-19. And again, this is to keep your patients safe, the dentist safe, and the dental team members safe. I suggest that you create a COVID-19 office procedure book that includes all of the required information. The ADA's Return to Work Toolkit has sample COVID-19 forms and scripts that your staff can use when speaking with your patients. I also suggest that you practice your COVID-19 office procedures with your staff before you begin opening the doors to your patients. In compliance with the Dental Board's emergency rule, I would also recommend that you consider your patient flow into, through, and out of the practice, timing for operatory usage and sterilization, and your staff routines as they don and doff PPE, and the best time to daily schedule them when returning to patient care. I also suggest that you document your training of your staff, and I suggest that you document daily DHCP screenings that include taking temperature. And although many of you on this webinar already know this, it did come up during a dental board meeting. The definition of dental healthcare personnel includes dentists, dental hygienists, dental assistants, dental laboratory technicians, students and trainees, contractual personnel, and other persons not directly involved in patient care, but potentially exposed to infectious agents. So how long are these emergency rules going to be in effect? The Dental Board's emergency rule will remain in place until Governor Abbott's COVID-19 disaster declaration is terminated, at which time the Dental Board would likely rescind the emergency rule. But the Dental Board can also amend the emergency rule if Governor Abbott issues a new executive order modifying or otherwise changing GA-19. Generally speaking, state emergency rules remain in effect for up to 120 days, and they can be extended an additional 60 days if needed. And that's the standard for any state agency rulemaking, regardless of the subject of the emergency rule or the agency that's issuing the emergency rule. Emergency rules aren't created to go on indefinitely, but they're designed to be flexible so that state agencies can make changes without having to go through an entirely new emergency rulemaking process. TDA will continue consulting with Governor Abbott about the possibility of adjusting some of the COVID-19 dentistry-related standards as we continue as a state to get more data about COVID-19 and how it is impacting Texans. So dental healthcare personnel considerations, that's the dentist and the team. So DHCP that are experiencing influenza-like illnesses, a fever with a cough or a sore throat and muscle aches should not report to work. DHCP who are older, have pre-existing medically compromised, have a pre-existing medical condition, are pregnant, etc., are perceived to be at an overall higher risk for contracting COVID-19. So your dental healthcare personnel that don't fall into the categories I've just listed should probably be prioritized for providing patient care. Information on COVID-19 and pregnancy is very limited, but offices may want to consider limiting exposure of pregnant staff to patients, especially during higher risk procedures. An example of that are the aerosol generating procedures, if this is feasible based on your staffing availability. DHCP are required to self-monitor and remain alert to any respiratory symptoms. Again, that's a cough, shortness of breath, sore throat, and they are required to take their temperature twice a day, regardless of the presence of any other symptoms that might be associated with COVID-19. Your office procedures must include a patient pre-screening protocol. This must be done at the time you are initially scheduling a patient and when confirming the patient's dental appointment. You must schedule patient appointments to minimize contact with other patients in the waiting room. An example would be considering potentially separate office hours for patients that have been designated at higher risk due to comorbidities or age. For example, patients that are 65 years of age and older, especially patients in that age group that have other medical issues like heart disease, diabetes, cancer, or a weakened immune system. You need to notify patients when you're pre-screening them that they It is recommended that they don't bring any companions or their family members to their appointment unless that patient requires assistance. An example of that's your pediatric patients, your special need patients, etc. It's also advised to recommend that patients check their temperature at home. If their temperature is below 100.4 degrees, it's reasonable to schedule the patient's appointment and confirm this again upon the patient's arrival. It's also suggested to administer some type of COVID-19 questionnaire as part of your screening. We have a good example of this under our Reopening Your Practice webpage on TDA.org. The ADA has an example of a good COVID-19 screening questionnaire in their interim return to work toolkit. It's suggested that if you get any positive answers to your COVID-19 questionnaire, that you consider referring patients to their primary healthcare provider, and it's recommended that you not schedule the patient for dental treatment. As you're discussing in particular any of the patient's responses to the COVID-19 questionnaire questions as part of their screening, please remember you've got to maintain their patient confidentiality. You must also have within your COVID-19 office procedures patient and companion in-office screening protocols. This must include checking the patient's temperature when they arrive at your office for the appointment. Again, the suggestion and the recommendation is if it's below 100.4, you could go ahead potentially and treat the patient. If it is above 100.4, you should consider not performing treatment on that patient during that day. Again, it's recommended that you administer a COVID-19 questionnaire. And again, recommended that if you receive any positive responses to COVID-19 questionnaire questions, that you consider referring the patient to their primary health care provider and not treating them, all the while, again, referencing and remembering how important patient confidentiality is. If the patient's bringing a companion with them, you need to perform the exact same in-office screening protocol on the companion as you do for the patient. This means taking the companion's temperature when they arrive at the office and performing the in-office companion screening protocol, which should include a COVID-19 questionnaire. Once again, if you receive any positive answers to the questionnaire or the companion has a fever of over 100.4 degrees, it's recommended that you not allow the companion to accompany the patient during their dental visit. You must have a dental health care personnel in-office screening protocol. This must include reminding yourself and your staff to self-monitor by remaining alert to any respiratory symptoms, the coughness, the shortness of breath, the sore throat. They must check, you and your staff must check your temperature twice a day, regardless if you're showing any symptoms that are consistent with COVID-19 infection. My suggestion is that you take everyone's temperature, all yours and your staff, when you arrive at the office. If everyone's below 100.4 degrees, the day could proceed. If anyone's above 100.4 degrees, recommended the staff is sent home or referred to their, personal health care provider. And I also recommend that you administer daily the same COVID-19 screening questionnaire that you're using for patients and their companions, that you administer that to yourself and your staff on a daily basis as well, and that you are documenting all that the staff has responded negatively to the COVID-19 questions, and that you're documenting dentist and dental team temperature twice a day. So transmission-based office protocols are part of your COVID-19 office procedures that you must have. And considering that patients who are asymptomatic may still be COVID-19 infected, it should be assumed that all patients can transmit the disease. You must immediately contact your local health department if you suspect that a patient has COVID-19, and this will help prevent transmission to yourself, your staff, other patients, etc. On TDA's Reopening Your Practice webpage, we have a link to the Texas Department of State Health Services map for COVID-19 testing sites. You must remove magazines, reading materials, toys, and other objects that may be touched by others and cannot be easily disinfected. Another suggestion is don't take, if you're still operating with paper records or other paper items as part of your patient records, don't take those into the operatory when you're treating the patient. You're required to prominently display signage instructing your team and patients on standard recommendations for respiratory hygiene, cough etiquette, and social distancing. The CDC has a great sign that you can print and post in your office called Stop the Spread of Germs. And we have, again, a link to that on our Reopening Your Practice webpage. A suggestion, depending on your office size, is that patients may need to wait in their personal vehicles or outside the dental office until it's time for their appointment. Another suggestion, depending on your office size, is the same for the patient companions. They may need to wait in their personal vehicles or outside the office. If it's possible, have clear barriers that separate the front desk staff from the patients. Otherwise, try to maintain that 6-foot distance when possible between the front desk and patients when you're conducting the office functions, such as checking them in, accepting payment, scheduling future appointments, etc. If possible, separate patients by 6 feet in the waiting area or have barriers separating patients in the waiting area. Disinfect the waiting area between patients, disinfect the operatory between patients, and repeatedly throughout the day, disinfect high-touch surfaces. Remember that the Environmental Protection Agency has a list of accepted disinfectants for use against COVID-19. Again, that link is available on our Reopening Your Practice webpage. Provide hand sanitizer throughout the dental office that contains at least 60% alcohol. If possible, limit the number of staff in the operatory with the patient, and contact your malpractice carrier about discussing possibly needing to revise your informed consent forms as you provide treatment during the COVID-19 pandemic. Dental healthcare personnel are required to adhere to standard precautions, which include but are not limited to hand hygiene, the use of appropriate PPE, respiratory hygiene etiquette, sharp safety, safe injection practices, sterile instruments and devices, and cleaning and disinfecting environmental surfaces. I recommend that you reinforce with your staff, yourself and your staff, strict adherence to hand hygiene, including before and after contact with patients, after contact with contaminated surfaces or equipment, and after removing PPE. Dental healthcare personnel within 6 feet of any and all procedures likely to involve aerosols must use an N95 respirator mask, a KN95 mask, or their substantial equivalent. Dental healthcare personnel must complete the full treatment of one patient before leaving the treatment area to treat another patient. Dental healthcare personnel must follow the standard sequence of donning and doffing PPE. You can see a great example from this from the CDC. They have a PPE sequence graphic. If it's possible, use isolation gowns. Disposable gowns should be discarded in a dedicated waste container after use, and cloth isolation gowns should be laundered after each use. Dental healthcare personnel should change from scrubs and out of scrubs and other PPE into personal clothing before returning home for the day. So PPE, generally speaking, respirators, masks, gowns, etc. We know that there has been a lot of concern about the accessibility of PPE, and we're actively working to secure leads and resources on respirators that meet the state board requirements in the emergency rule for dental practices. We're actively working right now with Governor Abbott's office and Chief Nim Kidd with the Division of Emergency Management regarding this issue, and we will share information as it becomes available. In the meantime, review the TDA Perks Supplies website for details on PPE supplies in stock and available for ordering. That includes KN95 respirators, level 2 masks, face shields, coverall safety suits, and infrared thermometers. So what is substantially equivalent to an N95 or KN95? According to a TSBDE statement on May 1st, this does not include the combination of a surgical mask and face shield. Let me stress that again. A surgical mask and a face shield is not substantially equivalent to an N95 or KN95 respirator. Now, we can't give you legal advice. TDA does not give legal advice, as I said at the beginning of this, but we do have information on our Reopening Your Practice page that lists types of other respirators that are considered substantially equivalent to an N95 or KN95. A question I've gotten is whether a gown can be worn for more than one patient if there was no aerosol splash or splatter generated on the gown and it's not visibly soiled. In this case, you need to look again at the CDC strategies for optimizing the supply of isolation gowns, specifically the crisis capacity strategies for extended use of isolation gowns, reuse of cloth isolation gowns, and prioritizing gowns. Remember that you need to change a disposable gown or cloth gown if it becomes soiled. Another question I've had is whether a gown is necessary for patients where there will be no aerosol splash or splatter, like a typical hygiene check or an emergency exam where no treatment is being performed. Again, you need to refer to the CDC guidelines that I just mentioned, and links to all of these are available on the Reopening Your Practice webpage on TDA.org. Going back quickly to what is considered generally substantially equivalent to an N95 or KN95, and I referenced that this is on our Reopening Your Practice page, but substantial equivalents include KP95, PFF2, P2, DS/DL2, and Korean Special First. Please be aware of counterfeit respirators. Look at our Reopening Your Practice webpage and the TSBDE website for links to CDC information about NIOSH-approved respirator masks and counterfeit masks. So say that, pardon me, let me go back just a second. So again, clarifying, do dental healthcare personnel have to wear the respirator when they're delivering any type of dental care? Again, let me stress, no. You only need to wear the respirator or their substantial equivalent if you're going to be within 6 feet of any and all procedures likely to involve aerosols. So what does it mean to fully complete patient treatment? So the Dental Board's emergency rule is very clear that dental healthcare personnel must complete the full treatment of one patient before leaving the treatment area and on to another patient. So we understand, TDA understands, that this current standard differs from your typical patient workflow prior to COVID-19. However, the governor and the strike force are utilizing, as I said before, a phased approach to opening Texas, and dentistry was very fortunate to be part of phase 1. So the focus is remaining on safely delivering care to Texans, and at this stage, it includes following the state board's COVID-19 emergency rules minimum standards for safe practice, meaning you must fully complete the treatment of one patient before leaving the treatment area and on to another patient. As the data hopefully continues to trend in a positive direction, as I talked about before, TDA will ask Governor Abbott to revisit this standard and others as part of his continuing phased approach to reopening Texas. Your COVID-19 office procedures must include transmission-based precautions that focus on your clinical techniques. If it's medically safe, You need to have your patients perform a pre-procedure rinse. This is used to decrease a patient's microbial load. Examples of this are chlorhexidrine and the original gold bottle Listerine. Dental healthcare personnel can only use hand instruments and low-speed polishing tools for hygiene services. You should see examples of a low-speed polishing tool and examples of hand instruments on this webinar page. The point is to reduce aerosol production as much as possible. This includes prioritizing the use of hand instruments in other situations outside of hygiene services. If dental healthcare personnel is going to be performing an aerosol producing procedure, you must use dental isolation. Again, this is to help minimize aerosol or splatter. And you need to instruct your patients to contact your office if they experience COVID-19 symptoms within 14 days after the dental appointment. So what's the difference between hygiene services and hygiene procedures? The state board's emergency rule requires dental healthcare personnel to only use hand instruments and low-speed polishing tools for hygiene services. According to the dental board, hygiene services include routine general cleanings, which are examples are the adult and child prophies. And they clearly have given guidance that no ultrasonic devices may be used for hygiene services. So hygiene services generally fall, and this is not an absolute rule, but they generally fall between the D1000 and D1099 preventive codes. A Cavitron, even on a low setting, is not the same as a low speed polishing tool and can't be used to deliver hygiene services. But dental healthcare personnel can use ultrasonic devices for periodontal treatment when it is deemed medically necessary as a part of the patient's dental treatment plan. Examples of hygiene procedures, again, not an absolute rule, typically fall within the D4000 and 4999 periodontics codes. As with every treatment that a patient receives in your office, you've got to properly document that treatment in the patient's record. So as a precaution, I recommend that the dentist document the medical necessity of using the ultrasonic device for the patient's periodontal treatment. Your COVID-19 office procedures must have a protocol if dental healthcare personnel suspect an exposure to COVID-19. Dental healthcare personnel that are experiencing the influenza-like illnesses with the symptoms I talked about earlier should not report to work. I suggest that you document, as I said before, a DHCP's fever and/or COVID-19 symptoms during the workday, and then have them immediately leave the workplace if they start exhibiting a fever or symptoms during the day. I recommend that if you or yourself are caring for an individual that tests positive for COVID-19, that your office should consider that if it's the dentist themselves or a dental team member, not report to work. The ADA toolkit has a great one-pager on what to do if someone on your staff tests positive for COVID-19. And these are all things you need to consider as you're putting into place your office procedures if a dental healthcare personnel suspects an exposure. Dentists are required to notify patients if an employee who may have interacted with them tests positive for COVID-19. And I recommend that you also inform your fellow team members about possible exposure. Dentists are recommended to follow the patient notification rule laid out in 22 Texas Administrative Code 108.5 to notify patients if an employee either becomes positive for COVID-19 or if an employee tests positive for COVID-19. Dentists are also recommended to report to their local and state healthcare authorities in the event that they identify a patient or employee with COVID-19. We have a link to this process on the Texas Department of State Health Services website from our Reopening Your Practice webpage. And remember, throughout all this process, you've got to maintain the confidentiality of your employees as required by the Americans with Disabilities Act. And again, this slide just goes through what I've talked about before, which were suggestions for documentation and suggestions for staff workflow for those that might test positive for COVID-19. And again, a reference to the ADA toolkit. Since this is so important, this again is another slide that dentists need to notify patients if an employee that may have interacted with them tests positive for COVID-19. It again shows the suggested rule that needs to be followed for patient notification and reporting, the process for reporting to your local or state health authority. I've gotten a lot of questions about point of care testing, and I have some guidance from the dental board. You need to be thinking about that, concerns about accuracy, and warnings about gray market. So I consulted with the dental board, and my understanding of their position is that the Dental Practice Act does not give dentists the ability to administer medical tests, such as a serology test for immunity and the molecular test for the virus itself. Both are considered medical tests. And separate from that, there's just concerns about the accuracy of antibody testing in general and antigen testing. And the ADA is advising dentists to stay away from the so-called gray market point of care tests for COVID-19 and recommend that dentists follow directions issued by the FDA regarding testing procedures in dental practices. So we're closely watching this point of care testing debate. And we agree that at some point, dentists are going to need to be able to access a fast point of care test that accurately predicts COVID-19 in real time. So if such a test becomes available and is scientifically sound, we'll advocate that dentists be able to use it in their office to screen patients and their staff for COVID-19 and do so as a diagnostic test for dentists, since dentists aren't treating COVID-19 as an illness. And again, a reminder that the FDA is maintaining an updated frequently asked questions page regarding diagnostic testing for COVID-19. And this page has answers to questions relating to the development and performance of diagnostic tests. So I want to thank everyone for participating today. Again, we regularly update our COVID-19 resources, not only on our immediate landing page, which you can see on the screen, but also on our Reopening Your Practice webpage. I wasn't able to take any questions today, but I do have a platform for you to be able, TDA members, to ask questions. You can email me directly at drhodes, that's DRHODES, @tda.org. For me to be able to respond to the email, you must include the name of the dentist and their ADA membership number. Now, again, please remember, we cannot provide you legal advice. We cannot give you specific direction how to proceed in your office. Dentists have, under the Dental Practice Act, the ability to exercise their independent professional judgment as it applies to clinical care and decisions made in their offices. As long as you are following the regulations that are in place through the governor's executive order and through the dental board's emergency rule, you can exercise your judgment about how you get to that compliance point. We will not be able to tell you, do this, do that, or lay out specific processes for you. What we can provide you is accurate and thorough synopsis of the dental board's COVID-19 emergency rule and answer those questions where we can refer you back to the rule section directly, or we have an interpretation that I am confident is accurate and will hold up. So I want to thank you all for being here today. TDA is here to help you through this process. please don't hesitate to reach out to me. Again, include your name and your ADA membership number, and I'll be happy to answer those questions as quickly as I can. One last pitch, all the information today is on our Reopening Your Practice webpage on tda.org, and it is not behind our firewall. So any dentist can access it, any team members can access it. I update the FAQ on a daily basis, so please go to that page for additional assistance. And everyone, please stay safe.